Hello everyone, my name is Ikra Mughal. Today our focus is on oral cancer. In today's lecture, we'll follow a structured agenda to delve into our topic on oral cancer. Let's kick things off by getting to know each other. I'll share a bit about myself, including my professional background and experiences in the medical field. Moving on, we'll dive into the introduction of our main topic, oral cancer. We'll then explore the existing literature on oral cancer. Next, we'll shift our focus to various treatment options available for oral cancer. Lastly, we'll engage in a masterclass session. I am currently serving as a medical receptionist at Good Mace Medical Practice with a background that spans 2 years as a lecturer at Istra Dental College, 4 years as a general dentist, and my ongoing pursuit of a master's in health and medical education from University of Hertfordshire. Let's discuss our topic, oral cancer. Oral cancer refers to the cancer that develops in any part of the oral cavity, including the gums, tongue, inside the cheeks or lips. I've chosen it to be my topic because oral cancer and its treatment can cause dental problems. When it is untreated or the treatment is delayed, it may lead to death, and there are other complications that may include spread of cancer, speech and swallowing problems, nutritional deficiencies, dental problems such as tooth decay, gum diseases, and high risk of infections. Moreover, it can also lead to jaw and facial disfigurements. For that, early detection and prevention is needed. Now we know the significance of early detection and prevention. Early detection process include regular dental checkups, oral cancer screenings, awareness of symptoms, and risk factor awareness. Here is a pamphlet for helping people detect oral cancer in the early stages. This is an example of technology being used to increase awareness about self-screening for oral cancer. To prevent oral cancer, it's important to make some healthy choices, such as reducing the consumption of tobacco and alcohol, adopting sun protection, including a healthy diet, human papillomavirus vaccination, maintaining good oral hygiene, engaging in regular exercises and physical activities, and limiting areca nut and betel nut consumption. Here's a link to a YouTube video. Please refer to the video as it provides insights into preventive measures. This is another great example for technology being used in increasing awareness related to oral cancer.
Today we'll be focusing on cancers that occur in the head and neck, also called oral and oropharyngeal cancers. In this video, we'll review the risk factors for oral cancer, steps you can take to protect yourself from oral and oropharyngeal cancer, and some of the treatment options that are available for these cancers. I'm Dr. Lydia Shapira. I'm a medical oncologist and a professor of medicine at Stanford University. Oral cancer affects the mouth, and this includes the lips, the insides of the cheeks, the gums, the floor and roof of the mouth, and most of the tongue as well. Oropharyngeal cancers are those that develop in the area that is behind the mouth. The oropharynx includes the throat, the base of the tongue, and tonsils. Many of these tumors start in flat squamous cells that form the surface layer of tissue inside the head and neck. Oral and oropharyngeal cancer is becoming more common. From 2008 to 2017, the number of oral and oropharyngeal cancers increased by roughly 1% every year. This means that more people are diagnosed and going through treatment. And while many are cured, there are also more people who have died from this disease. The single largest risk factor for oral and oropharyngeal cancer has and continues to be the use of tobacco products. This includes smoking cigarettes, cigars, or pipes, or using chewing tobacco or snuff. The connection is strong. 85% of oral and oropharyngeal cancers have been linked to tobacco use. Stopping the use of all tobacco products is important and is the best way to reduce your risk. Even if you've been using tobacco for years, stopping now can reduce your chances of developing oral cancer. Heavy and frequent alcohol consumption can also increase the risk for developing oral cancer, and this effect is even more pronounced if alcohol and tobacco are used together. There is another risk factor that is unrelated to smoking or drinking alcohol, and that is a viral infection with a human papillomavirus. The human papillomavirus, or HPV, is a common virus and a risk factor for oropharyngeal cancer. In recent years, HPV-related oropharyngeal cancer in the tonsils and the base of the tongue has become more common. Sexual activity, including oral sex, with someone who has HPV is the most common way that someone gets HPV. There are a number of steps you can take to reduce your risk of HPV infection. Having many partners increases the risk of HPV infection, and using condoms does not offer full protection. So limiting the number of sexual partners offers some protection. Another preventative step is to receive an HPV vaccine before becoming exposed to the virus. The CDC recommends routine HPV vaccination for children as young as 9 and for adults 45 and younger, and most doctors recommend it for everyone up to age of 26. Once a cancer has formed, it is important to make the diagnosis as soon as possible. If oral cancer is diagnosed at an early stage, it can often be cured, and the prognosis is very good. But if it has spread to surrounding tissues or organs, the prognosis is less favorable. Catching the cancer early gives a patient many options for treatment. The healthcare team that takes care of a person with head and neck cancer includes several different specialists and therapists. With oral cancer, the primary goal of treatment is to cure the cancer and preserve the function of the organs and a person's quality of life. That is why we need a team that works with the patient to prioritize how the person feels and looks and talks and eats, swallows and breathes. The cancer treatment team includes a medical oncologist, a doctor who treats cancer using chemotherapy or other medicines, a radiation oncologist, a doctor who uses radiation therapy to treat cancer, and a surgical oncologist who, with increasing advancements in surgical technique, can often perform minimally invasive surgeries to remove the cancer. Once this core group of cancer doctors work to remove the cancer, another team will work with survivors to provide specialized care. This might include reconstructive plastic surgeons and specialized dentists, speech-language pathologists who can help patients regain their ability to speak and to swallow, audiologists who can work with patients on any hearing problems caused by the oral cancer or the treatment, and psychologists and psychiatrists who can help patients and their families work through the emotional, psychological, and behavioral challenges that might be associated with going through the process of recovering from oral or oropharyngeal cancer. I hope that watching has given you more information about what oral cancer is, what risk factors make someone more likely to develop it, and what steps we can take to lower our risk of developing oral cancer. We also talked about the team of doctors and healthcare professionals that are there to support oral cancer patients in all the ways that they might need. Reach out to your doctor if you have additional questions or concerns.
Let's discuss the treatment options available to treat oral cancer. Radiotherapy. Radiotherapy damages the cancer cells by using radiations to disrupt their DNA, preventing their further growth. Here's an image that shows a linear accelerator device that produces X-rays of increasingly greater energy for deeper X-rays to go deep into the target tissue. This integration of technology into healthcare is improving the efficacy of cancer treatment. Chemotherapy. Oral chemotherapy is by far the most effective treatment option for oral cancer. There are two images. In the first image, it shows a nurse treating a patient suffering from oral cancer using oral chemotherapy. In the other picture, you can see medical professionals using electronic health records before treatments. There's another option for treating oral cancer, that is surgery. Surgeons perform a maxillectomy or partial maxillectomy by making a hole in the patient's mouth to remove the bones in the roof of the mouth. Sometimes this surgery is also done partially. In this picture, you can see transoral robotic surgery being done on a patient using minimally invasive robotic surgery treatments. I'm involved in closed-loop communication and interactive multimedia for educating healthcare professionals about oral cancer. I believe this masterclass can be used to teach healthcare professionals in any country and in any facility, regardless of available resources. Here, I conduct a simulated scenario exercise for students, emphasizing on closed loop communication with a structured approach by incorporating the SBAR handover method, covering situation, background, assessment, and recommendation. These are